Dr. Gajar. How are you doing today?
Doing well. It's an honor to be here.
Well, I'm so happy you're here. And why I'm getting your introduction. Where are you at today? What part of the country?
I am in New York City.
Okay.
Yep.
Well, let me introduce you. Dr. Gajar is an assistant professor of clinical pediatrics in the division of pediatric nephrology at Cornell Medicine and an assistant attending pediatric at New York Presbyterian Phyllis and David's Children's Hospital. That's a word. Phyllis.
It's a mouthful.
Children's Hospital. She cares for the children with a range of kidney disease, including hypertension, glomerulonephritis, acute kidney injury, chronic kidney disease, and for child needing pre and post transplant care. So we're so excited that you're taking your busy time schedule, and I know we're anxious to hear what you have to say about COVID and kidney care.
Thank you for the introduction. I'm Dr. Radha Gajar. I'm a pediatric nephrologist, like was mentioned, at Komansky Children's Hospital here in New York City. And I'm honored to be able to talk to you guys today about COVID and children with kidney disease and what to do. I don't have any financial disclosures. So in sitting down to prepare for this talk, it helped me to kind of take a couple of moments to think about what we've been through over the past year and a half, almost 2 years now. And so I wanted to kind of go over some of the major milestones of the pandemic with you all to help frame the rest of this talk. So we start in December 2019 when the World Health Organization, or WHO office in China, started getting reports of pneumonia from what they couldn't identify as a cause. So this was the first kind of indication that there was a novel new virus causing pneumonia in these patients. Shortly thereafter, January 2020, the White House develops the coronavirus task force that was established to spearhead efforts to help identify this virus and develop public health measures to mitigate the risk. The public health emergency was also declared at that point. In March of 2020, the WHO declared COVID-19 a global pandemic. President Trump declared a nationwide emergency. About 9 months later, in December of 2020, we get the first authorizations for the Pfizer and Moderna vaccines, and vaccine administration in adults begins. In May 2021, Pfizer receives an emergency use authorization, or EUA, to be able to administer their vaccine in children 12 to 15 years old. And the big news of the week is that just this week, Pfizer applied to the FDA for a license to be able to administer the vaccine in children 5 to 11 years old. So obviously, parents are eagerly waiting for this information, so stay tuned for news. And I encourage you, once more information is released, to reach out to your medical provider to help make a decision about vaccination for your children. All right, perfect. So by the numbers, based on 2019 data from the Census Bureau, the total US population is about 328 million people. As of, I think it was the end of September, the CDC is estimating that there have been 43.3 million cases of COVID in the United States. Focusing on children, children make up about 20% of the US population at about 73 million children under the age of 18. And so far, estimates put US pediatric cases at about 5.9 million cases of COVID. I'm just going to, as far as the chat and the Q&A, I'm going to try to get to those at the end, so I'm not distracted, if that's okay. So this is a graph that demonstrates the number of daily cases of COVID in the United States that were reported to the CDC. So this is from the CDC COVID tracker. And so important things to note are the units across the vertical line here. So you have, the increments are in 50,000. So this bottom line is 50,000 cases per day, all the way up to close to 300,000 cases per day, which we hit in the winter of 2020 and early 2021. As far as the pattern, what you can see is that there was a significant number of cases over the winter with a spike here. It subsequently improved. There are relatively low cases over the summer. And then there's another spike over the past several weeks, and we're starting to see some improvement there as well. This yellow superimposed line demonstrates the average number of totally vaccinated, fully vaccinated adults per week. So you can see that there's a lag because these vaccination administration, if you remember, started in winter in December of 2020. And patients could only be, or people could only be counted for this once they had received both shots, if they were receiving a 2-dose vaccine course, so Pfizer or Moderna, or if they received a single shot of the Johnson & Johnson vaccine. And so what you see is that there was a significant rise in the number of people, this is the average per week, of people who are receiving their vaccines. And it's important to note that the increments are different. So while these two peaks look like they're similar, the axis for the number of vaccinations is actually very different. So while this is, the max is 300,000, the increments for the vaccination rates are actually in units of 500,000. So this is 500,000, a million. So at one point, people were receiving in excess of 1.5 million cases per week. And while the numbers and statistics are important for us to kind of understand the overall impact of COVID, really what matters to us is the day-to-day impact that it's had on families and children. Every facet of children's lives have been upended by the COVID pandemic. Everything ranging from school to sports, extracurricular activities, scheduling things like holidays, milestones, traditions, graduations, proms, everything was upended. And importantly, social interactions were also challenging. Birthday parties were canceled. People couldn't see their friends. They couldn't see their family. They were isolated from their grandparents. It's been an incredibly disruptive time for everyone. You, as parents of children with kidney disease, know better than most how important every piece of care is for children with complex healthcare needs. Every part of their care has to work together seamlessly to help take care of children. So much of our medical system was disrupted during the pandemic. Appointments, whether it was regular checkups, follow-up appointments, sick visits, were either restructured, rescheduled, or canceled. Surgeries and medical procedures were delayed or canceled. Therapies, speech therapy, physical therapy, support services became difficult to access. And we're still in the process of kind of recovering from the disruption from all of this. One good thing that has come from the pandemic is that we as medical providers and our institutions were forced to develop the infrastructure to be able to offer telemedicine to families. This was helpful for a number of reasons. Number one, at the height of the pandemic, when there was so much uncertainty, it allowed us to continue to provide medical care to families while keeping them home in their home environment and safe. Moving forward, it's been helpful because it's allowed us to take care of patients in their environment. So we're able to see families at home, minimize travel time for families that live far away from their medical providers, especially as a specialist. Oftentimes our families travel from a long distance. It's efficient. The visits are very short. We're able to see people kind of in real time doing the things that they do, minimizing school absences, parent absences from work. Also it's easier to check in and kind of see the patient, get a sense of what's going on more than a phone call would allow us to do. I have done telemedicine visits with families in their car, in the school parking lot, the kids waiting to go to school. We're able to squeeze in a quick visit in the morning. Kid doesn't have to miss school, get an absence, get a note, anything like that. I have another patient family that was really appreciative of the telemedicine was a family with a newborn they had a hospital stay. They were really happy to not have to drag their newborn back out into the environment for a medical visit with me, for something that was easily discussed over the phone or over the telemedicine visit. The mental health impact of the past year and a half is undeniable. This is a study that came out of C.S. Mott Children's Hospital at the University of Michigan. And basically it was a survey that assessed parents' perception of mental health changes in their teenage children. And so you can see on the left, there's the results for teenage girls in orange. And on the right are the results for teenage boys in yellow. And what you see is that parents noticed increases in anxiety, depression, sleep issues, withdrawing from family, and aggressive behavior. And this included both worsening or exacerbation of pre-existing conditions or new developments. And while this particular study focused on teenagers, we're seeing this impact across the age spectrum from much younger children through adults. Just this month, a pre-publication report was released that was sobering, to say the least. Based on this study in the Journal of Pediatrics, which is one of our major journals, they estimate that about 140,000 children in the United States have lost a parent, custodial grandparent, or grandparent caregiver between April 2020 and June 2021. It's important to note that this doesn't include the most recent surge, which likely will impact those numbers. And this is important for two reasons. Number one, it highlights the importance of protecting ourselves and our families, keeping everyone safe, but it also emphasizes the support and resources that are going to be needed moving forward for families that have been affected by COVID. Zooming in on pediatrics specifically now, this is the report from the American Academy of Pediatrics and Children's Hospital Association that provides daily estimates of positive cases in children in the United States. This ranges from April of 2020 through the end of September 2021. And you can see, similar to the previous graph that we saw, that there's a spike in the winter months, low numbers over the summer, and then another spike that seems to be improving. The numbers here are in units of 50,000. And go up to about 250,000. And so at the beginning of September, we were hitting approximately 250,000 cases in children each week, sorry. This is a report that outlines the number of hospitalizations. And so the good news is that the overall number of hospitalizations is much, much, much lower than the number of cases that we see in children. So to date, there have been approximately 4,228 hospitalizations of children. This is broken down into approximately 1,600 in children 0 to 4 years old, and 2,625 in children 5 to 17 years old. And similar to the number of cases per week, you can see the pattern of hospitalizations follows, which makes sense. The gold bars are the children 0 to 4 years old, and the dark gray bars are children 5 to 17. And the axis here is ranges from 0 to 150 total. One of the questions that I often get asked in clinic is, does my child's kidney disease increase the risk for contracting COVID or having complications if they were to get sick from COVID? And the data that we have shows us that the number of the children who were hospitalized, so these are all pediatric patients who were hospitalized with COVID infection, 46% of them had no known pre-existing health condition. About 35% of them had obesity, and 15% had a pre-existing diagnosis of asthma. What you can see is that renal disease, highlighted here in red, only affected about 1.2% of children as a pre-existing diagnosis before they were admitted for COVID infection. The data that we have around COVID-19 in pediatric kidney transplant recipients comes from the IROC, or Improving Renal Outcomes Collaborative. And this is a multi-center effort that pools data and resources to provide high quality care for pediatric recipients of kidney transplants and develop best practices for children with kidney disease. There are about 34 pediatric kidney transplant centers that participate in the collaborative. And for this particular study, 22 centers provided data. So this report was published in January 2021 and reports data between April and the end of September of 2020. So again, not representative of the current situation with Delta. There's a natural lag in data analysis and publications. And so we're, I think, a little too soon to see meaningful information about our current surge. But what this study showed is that in the 22 centers that contributed to the study, they provided care for approximately 2,732 patients with kidney transplants. Of those patients, 281 patients had a COVID test performed. Of those 281 patients, only 24 of them had a positive test. And of those 24, 16 were able to be managed at home, and 8 required hospitalization. 6 patients were managed in a general unit, and 2 patients required an ICU stay. Of these 24 patients with positive tests, there were 0 cases of respiratory failure requiring intubation, transplant loss, or death. As far as measures that can be taken to decrease the risk for children with kidney disease to reduce the risk for infection, there's really nothing different than what should be done for children in general. So the healthychildren.org is a website that's put out in collaboration with the American Academy of Pediatrics. It's a wonderful resource. I'll talk about it a little more later. But they had put out this article, Caring for Children and Adolescents with Special Healthcare Needs in the Context of COVID-19. And what they recommend is a layered approach. So each of these kind of safety measures, hand washing, masks, vaccination testing, are all helpful at reducing risk individually, but together provide maximal safety. So as far as hand washing, it's important to review with younger children good hand washing technique, making sure that you're getting between the fingers, backs of hands, using soap, how long to wash and scrub. Some people sing the happy birthday song. There are plenty of YouTube videos to outline good hand washing technique. And it's important for parents to model consistent behavior for the children to follow. Masks are incredibly effective and safe for most children 2 years and older. There's a lot of consternation. I have 2 young children. There's a lot of questions about what's the best mask and do they need an N95, KN95 cloth mask? And really, the most important thing is to find a mask that's comfortable for the child and one that they're going to keep on their face and will minimize how much they're going to adjust it, mess with it, touch their face, which itself can increase the risk for infection. Vaccination, again, an incredibly important measure for safety. And so, like I mentioned, Pfizer's approved for an emergency use authorization for children down to 12 years old. And we're expecting to hear updates on the 5 to 11 age group in the near future. Testing is more and more becoming part of our routine. In the setting of symptoms concerning for COVID, PCR testing is considered the gold standard, but there are home kits that are available now at your local drugstore, at Walmart, that are also helpful to have in case there's a question, if someone's asymptomatic, but you're visiting an elderly grandparent or may have had an exposure and want to be able to test at home. We actually had an opportunity to use our home kits recently. My husband had an exposure at work. Someone became symptomatic in the evening after hanging out with my husband in the morning. We have 2 small kids at home, and so I wanted to make sure that he wasn't an asymptomatic carrier and at risk for infecting our children. And so we used our home kits in that situation. And again, it's important if you have any questions about any of these measures, testing, vaccinations, even masks, please reach out to your healthcare provider. This is what we do. This is what we're here for. And they will help give you guidance for your family and child. So the American Academy of Pediatrics does recommend vaccination, as I've mentioned, for children 12 years and older. And again, we should be getting information for that 5 to 11 age group soon. As we enter flu season, another important thing to know is that there is a recommendation that you can give routine childhood vaccines and the flu shot at the same time as the COVID vaccine. So if a family is pressed for time or has limited opportunity to make appointments for their children, you can actually kind of take care of both of these things at the same time. And especially depending on when this approval for the 5 to 11 year group comes through, we may see several patients getting both their annual flu shot and their COVID vaccine at the same time. For children with kidney disease and transplant specifically, there is a recommendation that children 12 and older who are considered immunocompromised receive a 3rd vaccine. This is something that has been in place for a couple of months now. And again, I recommend that you discuss with your nephrologist or your care provider if there are any questions. So one of the things that I wanted to do was to help give you resources to be able to use in your daily life. And so if we were doing this in person, I would have made some handouts or a flyer or something like that. We're on Zoom, and so we're going to try to take advantage of technology as much as possible. And so what I've done is the next couple of slides are include resources that I have kind of vetted and I think are helpful for families. They answer a lot of questions. I have put these QR codes on the slides. And so for those of you who haven't used a QR code before, basically you can open, if you have a smartphone, open the camera app, hover it over the QR code. You don't have to click it. You don't have to actually take a picture, but if you hover it, it should take you to a link for the website, and you will then have access to that website on your phone. So I'll give you guys a minute to test it out. And then we'll, and you'll see them on subsequent slides. They'll be in the top right corner. So one of the things that's important is, especially with children, to ask how they're doing, how they're feeling about their environment, about COVID, if they have any questions. Kids are incredibly smart and absorb a lot more from their environment than we oftentimes recognize. And so I understand that it can be hard to know how to truly broach the topic. And so the first resource that I wanted to provide you is a link to a page that actually gives you prompts. It's on healthychildren.org. Even if you just search healthychildren.org and COVID, you'll be able to find all of these resources if you're not able to use the direct link. So this kind of gives you suggestions on how to broach the topic with children and how to kind of minimize anxiety and concern. And like I mentioned, this website, healthychildren.org, has several articles on topics that have been identified as important for parents of children, ranging from ADHD and learning during COVID-19 to whether masks delay speech and language development, which has been a concern for several people, and guidance about face masks. So I encourage you, again, it's just healthychildren.org. And if you search COVID, you'll come to all of these articles. And that website, again, specifically has guidance for children and adolescents with special healthcare needs. This was that layered approach of protection that I had mentioned earlier. And finally, the CDC also has information that's helpful. Theirs is actually broken down by age range, which I thought was pretty was nice. And so you can scan the QR code, or I think these talks are going to be available later as a recording, so you can come back to it and try to access it that way. But this, again, kind of provides information for families on how to address questions around COVID with their children. So we've made a lot of advances over the past year and a half, learned a lot, but we still are going to have a lot to learn. So I think over the next several years, we'll learn about long-term health effects of COVID, the ideal vaccination schedule, whether it becomes an annual shot like the flu shot or a limited vaccine series like the other childhood vaccines. I think there's unfortunately going to be a lot of learning about social and mental health impacts, as well as educational effects. One of the reasons that I went into pediatrics is because children are incredibly resilient and thrive in almost every environment. We have an obligation and a duty to keep them safe and as happy as possible. And I hope that some of the information from today will help you feel more empowered for that, to do that. And I think I ran a little bit over, but hopefully that is okay. And then it looks like
there is a couple of questions, and there is one. While I read it to you, is it possible to take the QR code link and put it in the chat? It's obvious you work with younger people and more proficient on some of those things. I'm still getting a little bit familiar with using some technology as well.
I can try. I think probably the easiest thing would be just Googling healthychildren.org. All the references that I kind of used are in the on the website. And so the code is good for kind of a direct link, but you should be able to find it pretty easily. And then hopefully, I think, will families get an update when the recordings are available?
Yes, there will be. We'll send an email out to everybody on our mailing list about the recording when it's live. One thing we ask is that you put news@rsnhope.org in your address book, or if it goes to your clutter, to just say safe sender. Email's getting more and more difficult to get through. So there is a question here. Do we have any studies on the Pfizer vaccine specific to renal transplant children, effectiveness, side effects, etc.?
So as of right now, we don't have any data to be able to report. In general, anecdotally, we're a bit of a smaller transplant center, and so, but our patients have generally done well with the vaccine. As far as effectiveness, what we do know is that there is data to suggest, at least in the adult population, that transplant patients do have reduced response to 2 doses and tend to have more immunity after a 3rd dose. And so that recommendation for the 3rd dose in immunosuppressed individuals is definitely something to discuss with your child's doctor.
Well, and one follow-up question, there's been some news going around that some transplant centers are not going to consider transplanting somebody unless they've been vaccinated. I have feelings on that because I feel that, you know, if you're afraid of a vaccine, there's a lot of other drugs you're going to get that you may not want either. But we have a responsibility to the kidney as well as the person. So do you have any thoughts on that?
You know, it's actually a policy that's in place for other regular routine childhood vaccines at several centers, and has been problematic sometimes in the past, where if a family's at a center where there's a vaccine requirement, they may go to a center that does not have a vaccine requirement. We're just starting to get, as transplant, there was a dip in transplant numbers over the past couple of months. As transplant numbers are picking back up, it's an issue that's being discussed more and more. And so, you know, I think it's an ethically challenging question, but I do, given the scarcity of kidneys available, the number of people who are on the waiting list, adults and children, the number of people who have poor outcomes while waiting for a kidney, I think I agree with you that there's an obligation to kind of take as good care as possible of the kidney and maximize the chances of healthy, successful transplant.
I always make a joke that, you know, because I had 100% antibodies when I got my 4th kidney, and my creatinine's 0.6 today. But I'm sure if you turn the lights out, I glow in the dark. I had so many different treatments that worked. And, you know, it's a medical practice. And, you know, people need to realize that. And each center has their own way of practicing. And you may not like some of the rules, but hey, they didn't come to those decisions lightly. I know that. It went through a lot. And when you're dealing with the scarcity of an organ transplant, I mean, if you get COVID right after your transplant, a severe case, it could take you out and the donor kidney out very, very quickly. And sadly, I've lost a few friends to COVID. And they didn't even have the ability to get vaccinated. It was before the vaccination was available. So I think that's all the questions we have. I thank you, Dr. Gajar, and I'm so excited that there's young pediatric nephrologists joining the community, because I know all the old timers since I was growing up, and I know they're ready to retire if they aren't already. So we always need that next generation of people to care for pediatrics who have kidney disease. So I look forward to meeting you someday in person.
Absolutely. And it looks like Suzette posted the healthychildren.org link in the chat, which is perfect. Thank you for having me. It was an honor.
Thank you so much, and have a wonderful day. And a shout out to our corporate mission partners for making this happen.